That's the big question now for parents and for a lot of concerns on their mind about insurance agencies, if they're still going to be able to cover these vaccines. Now, last hour, we told you about the two biggest concerns from local pediatricians, the flu vaccine and RSV. Again, the question is, will insurance continue to cover the vaccines that are no longer recommended by the CDC? The Trump administration says that coverage will continue for families who still want the shot. Health insurers generally find vaccination a good deal because it's cheaper than a hospital visit. And many had previously said they'd plan to cover what was recommended last year through 2026. But a local pediatrician still has some concerns over the coverage.
And I know that the federal government did state specifically that insurers will still cover these immunizations, although I'm not sure how that's gonna pan out when you make statements that this is only for certain high-risk groups, or this needs to be a decision based between parents and their physician. That's sort of giving a question arising amongst insurers to say whether this patient actually does require this or is in high risk. And if a parent wants that immunization, like the flu or RSV, insurance have a means to deny them.
Well, coming up in the next hour, how should parents to decide to vaccinate their kids? Scott and Tess, you know there's a lot of mixed messaging from different agencies, the government now, so much information out there. So we'll have that again in the 7 o'clock hour, again around 7:30. Scott?